Good morning. This is Richard Edelman from New York. I'm joined by Kirsty Graham, who is president of our practices and sectors and also runs our global health business. So today we're going to unveil the results of our second Trust in Health Trust Barometer. I want to bring you back to January, where for Davos, we unveiled research that indicated that there were four forces that were causing polarization in the world. The first is expectations about economy. So if you thought that your family was going to be better off in the next 5 years, you were in the trust category. If not, and that was true of every developed democracy, you have a trust issue. The second is the relationship among the four important institutions. So business, government, NGOs, and media. If you had fairly equal relationships among them, you were in a trust zone. If you had two short legs of government and media and two high legs, business and NGOs, you were in low trust. The third factor was the mass class divide. If you had a substantial mass class divide, in other words, top 25% of population versus bottom 25% of population, a big gap, you were low trust. Fourth was, what's your level of belief in information? Did you have a sense that there were good facts available to you, or did you doubt the facts? Are we in a battle for truth? If that's the case, then again, you're in the low trust category. And in short, we found that a quarter of the countries that we studied were now polarized, where beliefs became fixed and ideology was ruling. So more or less, we decided to go into the field this year and test whether health had actually become a shop window for polarization. I think you'll be very impressed by the findings, or depressed. Next slide. So we've been in, I'm changing the slide, so I better do the next slide. Sorry. So we're in 13 countries. Early part of March, we did 13,000 respondents in short, and they were pretty well across the world, as you can see: Brazil, Canada, China, France, Germany, India, Japan, Mexico, Nigeria, South Africa, Korea, UK, and US. So let's get to the findings. So here we are. More or less, we see a shifting landscape of health. Inflation tops the societal factors that are negatively affecting people's health. Second, we see in polarization a sense that the system is unfair. And in short, a dispersion of authority is the third key factor. Amazingly, friends and family are now equal to traditional sources of health information, whether national government or even your doctor. Last, trust in the empowered patient. Because I can't get good facts, I'm going out myself to find information. Okay, so economic fears. This is important. The top economic result is we see not just a sense that my health is lower if I'm older, obvious, but if I'm lower income. We have a 20-point gap between people in the lower income category and those in the higher income category about whether they feel their health is good. Partly a pandemic result because they are frontline workers, but also the reality that they are scared because they can't afford good health. The number one issue that affects people across the world, more or less, is inflation. The second, pandemic restriction. People have mental health issues as a result of the pandemic. Also, lack of trust is a very high factor about things that make us sick. We don't know that we get good information. We also see today it is harder for me to take care of my health. Look, in 1 year, a 14-point jump about whether or not I feel that I'm being, in a sense, well taken care of, that I am able to take care of myself, that I take the time to take care of myself. In short, I'm not healthy. And you see this in markets ranging from South Korea to the US. Big jumps, 11 points, 16 points in Japan, 23 points in Korea. These are stunning numbers, folks. We don't see this kind of year-on-year jump. The biggest barriers to better health: cost and information. This cost factor, healthy options cost too much. I can't get good health care. I can't afford treatment. Again, it's the lower income people who feel particularly aggrieved, a 15-point gap between those with high income and those with lower income. If I'm low income, I feel screwed. Information, again, people feel they're not getting quality facts, and they're relying on themselves to get to information. Health is more than health care. I want you to appreciate that the tent is large now. We need all parties to feel part of this process. Why? Because mental health has become the #1 factor about health. If 1 in 4 people have mental health issues, everyone in this call knows someone who has depression. Everybody knows. So physical health is second, obvious, but also societal health, social health, that people care about me. And also I'm not being discriminated against. Last is my community. Is it safe? Is it clean? Is it sustainable? Beyond the healthcare system, all institutions are expected to keep us healthy. Yes, of course, my country's healthcare system would be #1. Who's #2? My employer. Remember from January, trust is local in my employer, my CEO, and my company's newsletter, more trustworthy than mainstream media, followed by government, business, media, etc. But that my employer is a big statistic. Also, cross the pitch. It's not just healthcare companies. It's also, we want food and beverage companies. We want tech companies. We want retailers. Also note for Gen Z, very important, fashion and financial services. In contrast to the older set, 27-point gap as to fashion and apparel. It matters that they participate for Gen Z. Among institutions, only my employer is seen as doing well on health. When we ask the question, who's actually making me healthy as possible? It's only my employer that's 50% or more. Healthcare system, NGO, business, government, media, all underperforming. Expectation, reality. Also, employers are the only non-health institution trusted with health. In terms of, I trust this institution in general. Again, my employer is higher than national health authorities or healthcare sector in general. That's a stunning finding. Trust is local. Every company's business is health. Yep. A little bit of a freeze here. Slide change. Okay, Kirsty, to you.
Thanks very much, Richard. So this next chapter is going to be about the rise in the informed patient and in peer voices. So first of all, let's look at what's happened in the landscape around trust in the media's healthcare reporting. Well, it's taken a dive since 2019. In fact, it's down 7 points. And I think if you look to the right-hand side, where you can see a sea of red, which is mistrust, you can just see how precipitous some of those drops have been. In the UK, down 11, in France, down 16. Rises, though, in China and India. And then we look at trust in peer voices. They are now on par with medical experts. We asked who people trusted to tell the truth about health issues. And my friends and family is sitting there at 76 points. It's up 11, which is statistically significant, and now on par with pharmacists and very close to health experts and scientists. We also learned that people are educating themselves far more about health. We asked, since before the beginning of the pandemic, have you been doing more or less in terms of educating yourself about health issues and verifying whether information is true? And you'll see by 3.5 or 3 margins, people are more likely to do this than less likely than going back to before the pandemic. So we see people being much more conscious about informing themselves about their health. This slide, I think, was shocking to us. Many people, including 44% of those in the 18 to 34-year-old category, believe that the average person can know as much as a doctor by doing their own research. That is a stunning finding. And look at the difference between the age bracket 18 to 34 and then those 55 and over. It's significant. And we wanted to know whether people would, where they were going to follow their doctor's advice. What's interesting here is they were far more likely to follow the advice of friends and family or social media advice if they thought the overall system was failing them. Conversely, if they thought the healthcare system was working for them, they were far more likely to follow the medical advice of their doctor. So it shows how important that trust factor is and how people feel about a healthcare system in terms of health outcomes. So what do we do? How do we build a healthcare system that people will trust? We also ask people, including those who have taken a change, made some positive health changes in the past year, such as a change in diet or an exercise regime. And we looked at the determinants. And I think what was so striking to us here, the two that we wanted to call out were those that centered around trust. Having a good relationship with their primary healthcare provider, very important, and trusting in the health ecosystem. Then when we look at the state of trust overall in healthcare companies, it's at 62%. It is in the blue, meaning it is in the trusted category. There has been no change in this in the last year. But I think if you look to the graph on the right, what you'll see is a lot of volatility in countries. So if you look at China and Japan have both moved up, then if you look at the US and in Germany, you see numbers going down. So a lot of volatility depending on the country you're talking about. I think what's probably most interesting is that box to the right, where we now see a 12-point gap between high and low income as to whether they feel trusting of healthcare companies. It goes back to that inequality point Richard made earlier. So this is also a really interesting slide. What comes through in this research for providers? People are saying, treat me with my whole self in mind. So for people to feel well cared for by a healthcare provider, 79% say treat my medical needs. Give me the medications I need. What's more interesting is that 76% of people say ease my concerns. Listen to me, take my concerns seriously, do not make me feel judged. And 63% say care about me as an individual. Understand the health concerns of people like me and let me ask questions about my life. For health experts, people are saying, talk to me like I'm your equal partner. If health experts are trying to get me to change my behavior, what are important things to do? Well, 60% of people said, include me in the science. Show me that the recommendations are based on data collected from people like me. 62% people are saying it's important that you show me how this fits into my life. And 67% of people say, give me a voice. Give me a way to ask questions and to be able to have my concerns addressed. And this, I thought, was a very interesting slide. You might recall some of this in our report last year because we saw similar trends. But we need to understand how to bridge the trust divide. Embrace the voices that people will hear. Now, if you go to the right-hand side, for those who have high trust in the healthcare system, their most trusted source of information is their doctor. The most believable channel for them is the National Health Authority. And what they expect in terms of recommendations of what they find the most convincing is clear, informal language. But for those who have lower trust in the healthcare system, their most trusted source is friends and family. Their most believable channel is my employer. And the most convincing attribute or recommendation they want is show me your credentials and let me ask questions. So very different universes around what people want to hear to have trust in the health ecosystem. This last chapter is around CEOs and employers investing in our health. And as Richard said earlier, health is now relevant for every single business. That's one thing we learned from the pandemic. Health matters. And for business, people are saying to improve their health, this is what they expect business to do. They want business to address those wide societal factors that affect our health. That's providing trustworthy health information, addressing those wider issues such as climate, inequality, improving the health of local communities, and convening stakeholders to improve healthcare. And for brands, you need to be optimizing for health across your products and operations. 64% of people said when deciding what brands to buy, they considered the impact of the brand, its products, and its business practices on people's health. That was a factor in their decision-making. What I think is particularly interesting in this slide is if you look at markets like China, India, Nigeria, Korea, Mexico, and Brazil, this is particularly important. So these are consumers who are really watching those practices. And finally, an important note here for CEOs. Show me that you value mental health and work-life boundaries. Richard spoke to the incredible increase we've seen in people talking about mental health and citing it as part of their healthcare concerns. Well, 77% of people said, my CEO must talk about the importance of mental health in the workplace. 78% of people said, my CEO must model healthy behavior, such as respecting boundaries between work and non-work and taking their PTO. And then I think in the extraordinary finding, considering this is global, 83% of people say their employer must implement policies to prevent burnout. So our concluding slide, what do we do with this? What are our recommendations? Well, there are 4. First of all, address health inequalities. Cost is the number one barrier keeping people from being as healthy as they want to be. It is super important that all institutions think about these societal issues and the inequities that we're seeing and how you show up in this dynamic. Those who are disproportionately affected with lower access to affordable care, how can you do something to change that? Second of all, leverage the dispersion of authority. Friends and Family has grown its trusted sources on health matters, and rather than fighting that trend, we believe you need to incorporate it into your approach. It comes back to those 2 universes I was talking about around where people go and how and who they trust for information. Thirdly, invest in employee health. Employees benefit greatly when their employer benefits in their well-being. Make this part of your talent strategy, especially for those early in the career and for frontline teams. And finally, optimize your business around health. Health has a bottom line impact on consumer decisions across businesses in all sectors. Make health central to your strategic planning, to your products, and your business operations. So with that, I think there were really, really interesting findings. And we're clearly at a critical moment when we think about the broader macroeconomic landscape, when we think about the inequalities we saw, and what this means for people's overall trust in the business and institutions that play a role in keeping them healthy. And to explore these findings further, I'm really delighted to introduce today's panelists. Each of these guests is a leader in his or her respective field and brings a unique perspective on how we can improve trust in health and in science globally. So I'd like to welcome the 4 of you. First of all, I'd like to introduce Angela Wasunna. Angela is Vice President, Global Policy and Public Affairs for Emerging Markets at Pfizer. Hello, Angela. I'd like to introduce Mark Henderson. Mark is the Director of Corporate Affairs at the Wellcome Trust. Welcome, Mark. Laura Helmuth is the editor-in-chief of Scientific American, and Sreejit Mohan is the global head of corporate brand and strategy and external engagement at Novartis. Welcome to all of you. Thank you. Thank you very much for being here. I'm going to begin with a broad question. Oh, I should also say, I'm going to ask a few questions, but for those watching, please use and submit your questions through the channel that we have below. But let me begin by asking each of you, that interesting findings. I'm curious as to what finding jumped out at you the most or what resonated for you. And I'll begin with you, Angela.
Thank you. Well, first of all, congratulations on releasing this really important trust barometer that's really entirely focused on health. Overall, I found the findings fascinating. And I'm particularly pleased that you're able to include a fulsome set of global voices with very strong representation from emerging markets where most of my work is focused. So for me, the finding that jumped out was that post-pandemic, people feel much more empowered to educate themselves from various sources, as both you and Richard have pointed out, and then just feeling that they know as much as their doctors. But with that empowerment and access to information, your survey also found that patients across the globe are still finding it much harder to make the right decisions about their health. So I can't help but juxtapose that finding, the empowerment surge, as it were, with the proliferation of disinformation and contradictory expert advice that is now prevalent in every geography. So for me, it seems to me that there's a huge opportunity to leverage this increased desire for health information or education, if you will, and the focus on self-empowerment by working in partnership with patients and society to develop trusted, easily accessible health information platforms that allow patients to make sound, scientifically based decisions about their healthcare. That was really profound for me.
That's great. Thank you, Angela. Laura, what struck you?
Oh, this was fascinating, the whole thing. Thank you for doing this survey. A few things stood out. I think the opportunity to help, especially younger people, understand the healthcare system, understand their own health, understand how information works and what is trustworthy and who is trustworthy. It seems like some of those age differences were pretty dramatic. And then, of course, for me as an editor at a magazine, of course, I'm very concerned at the lack of trust overall in media. And I think health and science journalists in particular have worked really hard to try and save people's lives over the course of the pandemic by sharing good information and protecting people from mis and disinformation and weaponized politicization of health information. But it just shows we have so much work to do, and it's really important. And I think, as Angela mentioned, there's some opportunities for partnership there too. If people are trusting their friends and family, where are they getting their information? And if we, it kind of shows that each individual we reach through good coverage of the media has the potential to share their trustworthy information throughout their social networks. And we need to think about better ways to do that by having, really useful, simple messages that explain what we do know and what we don't know and how we do or don't know it.
So you said so many things there that I want to come back to. Especially on misinformation. But Sreejit, what struck you most?
Yeah, Kirsty and the Edelman team, thank you so much for the invitation. This is great findings and really honored to be here with all of you. So a couple of things stuck out for me. So first is the broader definition of health. This is interesting because this is the similar feedback that we've received over many years from people living with chronic diseases, where the desire has been to see beyond the clinical endpoints when it comes to medicines, to actually look at a patient's experience with disease, the mental health implications of disease, the societal implications, and how all of that has actually now championed a whole patient empowerment movement over the last few years, where now it's almost regulatory guidance, where you have patient-focused drug development that the FDA is championing to make sure the patient voice is included in the development of drugs. So that's encouraging for me that in a similar way, you could actually see topics like mental health, now that there's a lot more awareness around it, that it can actually influence policy discussions at a much broader level. So you could extrapolate, what we've seen in chronic diseases to those areas. The second one that I can't help but notice is that you see the trust decline in healthcare providers and healthcare systems. And on the flip side, you also see that there is an increasing amount of healthcare worker burnout and also increasing strain in the healthcare systems. So you start seeing this correlation here, which means that we have to look at these problems at a system level. And every stakeholder, organizations, government, and NGOs, patient organizations, can actually play a role in shaping effective policies. We can't look at it in isolation. Those are a couple of things, Kirsty, that I thought were worth mentioning.
Okay, that's great. I want to come back to that partnership, and you make a very important point on burnout, including in healthcare workers, right? I think we all anecdotally see that in our lives, the people we know in the system and in the media as well. Mark, what struck you the most?
I was going to say really, really interesting data. I think more than anything, it was actually a connection between two pieces of two findings here. The first one obviously being the very striking finding that I think everybody has commented on about the extraordinary levels of trust in friends, family, people like me. But also, as you work through the slides, looking at maybe one of the pieces of information that may suggest why that might be. And it came down to that finding that the really important thing in being able to convince people to take health information seriously and to trust it is to treat them as equal partners in that exchange. I think it's actually, it's a broader, I think, trend in persuasion that and marketing that goes beyond just healthcare. We're learning, I think, increasingly that a kind of unidirectional, one-way flow of fact-based information isn't really very convincing, and it especially isn't very convincing when it comes up against people's deep-seated beliefs, values, and relationships. If you get into a battle between your facts and somebody else's relationships, their relationships are always going to win. And I think that's a really important message for all of us who care about conveying accurate and trustworthy health information to learn from. Some of the answers, I think, are there in your research as well. When you talk about, as Sreejit was talking about, when you talk about involving patients in the design of research, making sure that the people who the research is ultimately intended to benefit actually have legitimate and good reasons for believing that research is done in their best interests. These are the ways ultimately that I think will cut through this.
So I wasn't going to do this, but I'm actually going to go straight to that area of questioning, Mark, because, those two different universes and what we're learning around how people want their information to come in. Laura, I'm going to go back to you straight away and say, okay, we saw trust in media going down 7 points. In healthcare reporting, we also see friends and family rising. And to Mark's point, around who is influencing the ecosystem. Now, Scientific American you've been a leader in this field. How are you thinking about misinformation? How are you battling this and thinking about science and facts?
Yeah, it is. We think about it a lot. We feel like we're kind of locked in this epic battle between sense and nonsense and, signal to noise. And one of the hard things is that misinformation, especially things like conspiracy theories around COVID, around masking, around, everything to do with the pandemic and other health issues. Conspiracy theories are really interesting and they're weirdly empowering. People who kind of get taken up by them feel like they know something that other people don't know. And there's a lot of psychological reasons why mis and disinformation travels really effectively. And so from a media perspective, we have to make our stories just as sticky and memorable and gripping and understandable and appealing, even when it's bad news or even when it's difficult news. And so we're trying to improve our craft by having, clearer headlines, explaining better, here's how we did the reporting, here's how the scientists did the research, here's the evidence that we have so far. And a lot of what we do also is explain what isn't known yet, because a lot of times when people have a question, if there isn't an answer, they'll go looking and they'll find an answer, the wrong answer, a nonsense answer. So it can be really empowering to tell people, here's something that we don't know yet and why we don't know it. But yeah, it is a huge battle.
Yeah. How do you think about the younger generation? That finding that 44% of people between 18 and 35 actually believe that they can be just as knowledgeable as a doctor. What can we do with that?
Yeah, that's a tough one. And it's, I think when young people maybe don't know yet how much they don't know. And so it's this meta problem, and getting back to the problem between relationships and values and fact-based information. If somebody thinks they understand something, it's really hard to dislodge that belief.
Yeah, yeah. And I'm curious for Sreejit, Angela, Mark. You have I've spoken with all of you in the last year. How's your workplace and your institution thought about misinformation and tackling it?
I can go first. I mean, I think this is critical. Obviously, I mean, we rolled out the vaccine, as you know, during the pandemic, and making sure that people actually understood what they were getting and the importance of what that vaccine would do to their bodies was critically important. And I think, with this proliferation of social media, where to your point, Laura, young people go there, they get the information. There is a real need for not just pharmaceutical companies; it's really the healthcare professionals across the spectrum, plus educational experts, etc. It's really an all-in society effort to make sure that we are really providing science-based, evidence-backed information, but in a way, I think to the point the survey made, that meets people where they are. So making sure that we're speaking in the same language, making sure that we're speaking to them in a way that's respectful of their own situation. I think that's going to be critical. And we haven't always done a very good job at that, right? Really finding the right way to communicate this information, which hopefully endears trust. And I think at the end of the day, also demonstrating the impact of what our medicines, what we provide to society does in a positive way, I think is critical. And there's a gap there that I think we can fill, not just as healthcare companies, quite frankly, but as you said, Richard, this has to be across society.
I think for us, Wellcome, we're a large funder of science. We spend 1.6 billion pounds a year on science. For us, it's about the route to the science being trusted is to make sure that it's trustworthy, that it's working in the interests of the people who are going to use it, that we're thinking about their voice in the design of the science. And so we've just been through a strategy review. We've just identified, alongside our kind of traditional scope of discovery research, we're also working hard on climate and health and mental health and infectious diseases are big priorities. As we're designing those programs, what we are increasingly trying to do is to make sure that the voice of the communities and the people who are affected by those challenges are heard, not only right at the end when we've got something that we want to communicate to them, but much earlier in the process while we're still designing the research. If you're able to design that approach in partnership so that you're not just telling people things, you're actually asking them questions and you're involving them actively as participants in the research, I think that is the best way in the longer term of building research that people are more likely to trust.
So I think you made some really good points there. And I think all the data is showing that in terms of, give me a voice, allow me to ask questions, involve me in the science. Sreejit, what did you think of that?
Yeah. So Kirsty, I build off of what Mark was just saying. One element is a lot of work that we do in terms of incorporating the patient voice, making sure that there's that's a key way in which we are building trust. Another way in which we're looking at this is how do we work with voices that they trust, and especially in the area of clinical trials, as there's a lot of data around this where participation by minorities, Black and brown communities in clinical trials is lower. Primarily, one of the big factors is trust in clinical trials, misinformation about clinical trials. So one of the programs that we launched last year was partnering with the historically Black colleges and universities in the US to build capabilities amongst Black and brown clinical trial investigators, so that they are well equipped to actually have conversations around clinical trials, run clinical trials, and bring in a lot of these populations into these trials, because the end, the medicine has to represent, the trials have to represent the populations that actually benefit from it. So that is a
Sreejit, I think we have, okay. Sreejit will come back, I'm sure. But, I wanted to go to think about this in the expansive definition of health. So one of the things that we also saw in here is that issues like climate change, like pollution, inequality are rising much more into what people think about health. And I think that staggering finding Richard gave around mental health, I'm curious what you see in the worlds you live in. Are you seeing people making these connections, and how are you responding to that? So I think throw that one to you, Angela, first.
Yeah, and maybe I could just tackle that issue of just inequality because of inflation, because of the macroeconomic situation, which sounds like a big topic, but I think it really has great relevance for everybody. I mean, I think the findings made very clear that this issue is not just exclusive to emerging markets, right? Many wealthy countries cite inflation as a major concern. They've been impacted by war, the energy crisis. Even here in the US, a significant percentage of people feel less prepared to pay for unexpected healthcare costs this year than they did last year. But I think in the markets in which I work, in emerging markets, as shown by your findings, they've been hit the hardest. By the end of 2022, we know that an additional 75 million people were pushed into poverty, and poverty defined as, living on less than $2 a day. So people who are already living under vulnerable conditions, they've borne the bigger brunt of the pandemic, whose ripple effects they continue to feel. And in many of those countries, I think you mentioned it, Richard, as well, these countries don't provide safety nets. And so the current sort of macro situation comes down to how are families making resource allocation decisions, and what goes into that thought process, and where does healthcare fall in that list of priorities? So in the countries in which I work, women are the ones who usually make healthcare decisions for their families, and they tend to be the ones that sacrifice their own healthcare needs to spend on sort of their family's well-being. And so, as I said, while, inflation and, these big inequality issues might sound, like big sort of global topics, it has really effects at the household level and very much at the gender disparity level in emerging markets. And I don't want that point to be lost. At the national level also, I think the pandemic demonstrated really the connection between health and wealth, health and economic stability. And so healthcare is not just seen now as an issue that has to be sorted out by just the Minister of Health. It needs sort of whole government approach with ministers of finance being involved, labor, industry, education, etc. I mean, I think this is one of the things that we're seeing countries adopt, showing really that healthcare seeps across society. It has to be addressed as such. Now, I'll just mention quickly that in recognition of sort of these challenges, especially in developing countries, at Pfizer we launched a program last year called An Accord for a Healthier World to help 45 lower-income countries gain access to our most innovative medicines at a not-for-profit price. This program is geared specifically to governments that procure medicines, and it's one way that we're trying to meet governments, as I said, sort of where they are with the reality of inflation and all the other effects that have flowed from the pandemic.
I love what you said there, Angela, in terms of the individual. I think the role of women in households, and then all the way up to government. And this point that I think is so true and comes through in the data that, the issues that we saw at the start of the pandemic and then all the way through to this research really show that the impact on those who are already vulnerable is so much greater. And I think for issues like climate change, it is going to be that pattern is something that we have to try and grapple with. Mark, I know that Wellcome spends a lot of time on this.
That's right.
What it was really something I thought was really interesting in the data was when you looked at the answers that were given in different countries about climate change being an impact on your health today. There was a real divergence there. In France, in the UK, and US, largely the richest countries in the world, 40s and 50s percentage points. When you came to the middle income countries, the emerging economies, China, Brazil, India, Mexico, Nigeria, South Africa, the numbers were in the 70s. And I don't think that is coincidental. And I think if you were to also have added a layer of data on the really low income countries in the world, in some of the hottest parts of the world, which are most affected by climate change, I expect the numbers would be even higher. And I think we're going to see that escalate even more over the coming years. I mean, the reason that Wellcome is particularly focusing on climate and health is that ultimately we know that climate is already a health issue. It's already affecting health, but we also know very, very, very little about what will happen to many aspects of human health in a world that is 2-3 degrees hotter. We don't know very much about the physiology of the human body under those situations. And what we do know largely comes from professional athletes and soldiers. So not exactly the most typical and diverse group of people. So I think that's going to be a really interesting theme to watch, and something that will emerge as an even stronger influence on health, and will become something that I think people increasingly feel influences their health. I think you can already see that the countries where the impacts are greater today, people are starting to feel and notice that effect. I think we will pick up everywhere.
Laura, and just listening to the points Mark's making, when I think about your publication, are you seeing this expansive definition of health as well? How are you thinking about this?
Yeah, definitely. We're trying to cover more and more the relationship between climate and health, health inequities, the problem, the health-related consequences of racism and systemic bias. And it's all connected. And I thought it was really interesting and important in your survey to see that a lot of people are making those connections, and also that they care how businesses are addressing it, how their governments are addressing it, how the healthcare system is. So I think having this kind of grassroots support for businesses that do care about their environmental footprint, that care about mental health, that care about contributing to empowering people to have better healthcare. These are good business decisions, and I think they should be very popular politically as well. So it is nice to see some kind of growing awareness of how all these things are connected.
And Sreejit, I just want to pick up on Laura's point. I think you are back with us. Can you hear me? I can't hear you.
All right. Can you hear me now?
Yes, I've got it.
Sorry about that. Technical issue.
Not at all. We understand technical issues. We were talking about the expansive definition of health, and also why this is so important for people to recognize, but why it's also important for a business to think about that in a commercial planning exercise. How have you been thinking about this in Novartis? Are you seeing it, and how are you responding?
So I'd say, Kirsty, that we have been looking at this more systematically over the last couple of years, in looking at mainly how can we design experiences for patients, for healthcare professionals that go beyond our role as a provider of medicine, right? How do we look at information needs? How do we look at how they interact with our data? How do we, as I mentioned earlier, bring in patient voices and patient input into our drug development? So a lot of it is recognizing that it's beyond the what I would call the clinical endpoints that the patients care about. It's beyond what the physicians are looking at in terms of just health disease information. It's trying to really broaden the offerings is what I would say. And I'd say that where the opportunity that we have is beyond pharma. So let's say we're looking at companies that are beyond the sector, beyond the pharmaceutical sector. You have the opportunity to engage as an employer, but you also have the opportunity to engage as a community partner in tackling these broader issues of health. So mental health is a common topic that actually transcends companies beyond, beyond healthcare. So I'd say that's an opportunity for us to look at cross-sector partnerships.
So I'm going to stay with that theme because I think you made a very good point. And we were thinking about this as we looked at the research ourselves, that really these findings are not just about pharma. They're not just about healthcare companies. They're applicable to all businesses, but they're actually applicable to all institutions. So when we look at the role of the employer, I mean, people are trusting, particularly those who have low trust in the system. They actually say that they trust the information from their employer. If you think about that statistic around people believing their employer has a very significant role to play in preventing burnout and mental health, I'm curious, when you turn internally into your organizations, so not just what you're doing at the outside world, but internally, how are you as an institution thinking about these issues? Mental health, this is one of the biggest takeaways for me as the legacy or a legacy of the pandemic, inequality and the rise of mental health. But maybe, Laura, I'll go to you with that one first.
Yeah, this is something. So my magazine is owned by a global publishing company called Springer Nature, and we've done a series of internal surveys of employee satisfaction and ask a range of questions. And work-life balance, throughout the pandemic has been an urgent issue that from the CEO down, all managers, all leaders have been trying to address. And I thought it was very interesting in the survey that CEOs and other leaders modeling good behavior is really important. And I think that comes back to the importance of relationships we're seeing with people trusting their friends and family, trusting doctors and healthcare providers if they talk to them, treat them like equals, ask them questions about themselves. And I think we definitely see that within my organization is, focusing on employee health, satisfaction, setting good boundaries, taking your PTO, ending meetings early if possible, really being aware of, especially people who are healthy or providing care for children, for other relatives who have other demands on their time. Employers who think of their employees and treat their employees like people, like equals, seem to be doing much better at hiring and retention, and it's great to see.
I totally agree with that. That is one of the biggest findings out of this report. And it's very important for people here. And actually, we just had a question coming in asking about the role of the C-suite in supporting mental health. Angela and Mark, thoughts from you on this?
Yeah, well, first, let me just share an observation, which I think comes out of your study. I mean, this is I think we're all living in an increasingly polarized world, right? We see divisive views, not just in government, but also in the media, among healthcare experts, even in communities. People tend to be polarized where they live. And, we see people are sort of increasingly socializing with folks who share their views. They tune into platforms that echo what they want to hear or validate their own viewpoints. And the workplace is really one of the last remaining places where folks can engage in or interact in meaningful ways with folks who don't necessarily share their worldviews or look like them. I think diversity in workplaces really allows employers to model what we'd like to see in our communities, one where folks can really engage in civil and respectful ways, learning from each other, breaking down barriers. I almost see the role of workplaces as almost a call to action on how societies can engage. So at Pfizer, just sort of speaking to the question you asked, we place a huge emphasis on colleague well-being, and we invest in programs that are designed really around the 5 pillars of well-being: social well-being, physical, professional, emotional, financial. And let me just give 3 sort of forward-leaning examples of that. One is the company gives us what they call focus weeks. So 4 times a year, we get a week where we're not encouraged to put meetings on our calendars. We're being asked to sort of take a step back and reflect on the work we're doing, try and focus on high priority work, and also just take some time to recharge. Secondly, the company gives us what they call a global annual wellness day. So that's an extra day that's paid off for colleagues to just, again, focus on what really brings them joy. And then finally, we have a partnership with Thrive Global. Many of you know this organization that's really focused to work with colleagues to tackle the very issue Kirsty mentioned around burnout. Many other programs within the organization, but I think these 3 really speak to the times we're living in now.
That's great to have that level of specificity, Angela. And I think this is one of the most interesting findings, and also globally, right? It was across the globe that this was called out. Sreejit, what happens in Novartis? How do you think about this, the responsibility of the employer in mental health?
Oh, we take this very seriously, Kirsty. Very similar to what Angela was saying. We actually started this work, in the middle of the pandemic, where we started investing in resources around resilience, and working with an external third party on having an app that now I think 45,000 people inside the company now use on a regular basis. We also instituted our expanded parental leave program as a key offering for associates, so that they can actually benefit from time off at a very critical time and a beautiful time for them as parents. We've now actually looking at our well-being strategy and our health offerings. There is a push to start looking at broader mental health focus. We're partnering with organizations that provide coaching and support for large parts of the organization. So this is growing in importance, and we've been systematically investing more and more in the mental and social well-being aspects, in addition to the health, physical health parts.
I'm going to come back to the 4 dimensions because we've had a question on this as it relates to climate change. But Mark, was there anything you wanted to add on this?
Just briefly, I think to the question about the C-suite, you can't underestimate the power of role modeling and the importance of role modeling. If your corporate comms is saying take your time off and the CEO doesn't take his time off, then won't fly. Others will follow. And certainly, my old boss, Jeremy Farrar, who's just left Wellcome to go to the World Health Organization, was very good at that. Certainly, he instituted a policy of essentially no email after 7 p.m. and lived it himself in a way that was very instrumental in driving culture change on that respect. I think the other thing to mention about employers, and actually I think in a way, those of us who are on this panel probably aren't the best examples, because as a foundation, a media organization, with comms and pharma, we have a sort of, I imagine, a fairly high trust workforce ourselves. But I was so struck by the finding that the employer was the most trusted channel for those with the least trust. And I do wonder whether there's something that we could explore more as health messengers in engaging that channel and using that channel as the sort of secret sauce, perhaps, for getting to those who are least inclined to trust health messaging. And I'm sure it has to do with the personal relationship, with the fact that your employer tends not to judge you, has the opportunity for you to ask questions to you, etc., and have that more conversational, interactive relationship about health. I suspect is where that lies, but I'm sure that's something that would be well worth exploring further.
I think you make a very interesting point also around the say versus the do, right?
Yeah.
And the modeling, and particularly at senior levels of the company, because that's what all our data, in the last few years has shown about trust. You can't just go and make these noises, have these policies. People will measure you by the action. I've got a question here on climate. This is such a huge issue. How can companies better draw a connection to how climate change impacts all those 4 dimensions? So that's social, physical, mental, and communal. And how can they share their progress and their impact to the way that resonates with stakeholders? Who would like to have a crack at that?
What a great question. That is a really big question.
It is.
So yeah, go.
Maybe I'll start with number 1 is, I'd say, having it as a core part of the conversation, and making sure that you are giving it attention in whatever aspect of it that you own. From a pharma perspective, it's ensuring that you are actually having conversations at from a policy perspective on climate change implications. For example, are you going to see more infectious diseases showing up in the Western Hemisphere in ways that we haven't seen before? In looking at addressing future health needs in your portfolio decisions very early on, in looking at modeling that into your portfolio prioritization. And then I'd say that, every organization also has a massive responsibility on the environment side. So I think, addressing all of the key activities on reducing your carbon footprint, your net zero targets, keeping that front and center. Those are all sort of the base things that organizations can do, healthcare or non-healthcare.
I think it will depend a lot also on what sector you're in and what your business is. So, for example, if you are in manufacturing and you have, for example, factories with a heat issue within them, the way that question might materialize is perhaps different to a company that's more in the knowledge business.
And the only thing I'll add, I agree with everything that has been said, is just in this space, I think metrics play a big role to show that you're actually making progress towards certain targets. I think we'll go a long way in just getting the public to understand, that companies do care about this space, but in a way that impacts health.
I think, Angela, that's a very good point on data and metrics and how much they matter. So we showed a lot of data today. I have a final question for each of you. Some of that data was also quite sobering. And I think when we've talked about inequality, when we've talked about trust, when we've talked about where people get their information, what do you take from this that gives you optimism, or where do you think the call to action lies for you, for your organizations, or for any institutions that we've covered? I'm going to start with you, Laura.
Yeah, that's a great question. From a media perspective, I think a lot of takeaways. I think ideally, you look at things in terms of opportunities. There's a lot of opportunities for improving trust in the media. And I think also, one of the things we can do in the media is empower people to first of all, understand what's happening in the world, understand the results of this survey, understand what power individuals have to influence the health and improve the health of their immediate community, and by thinking of it from a climate change perspective, of the global community. So it's really, these are really important things for people to understand, that health is connected to all these things, and that we have a lot of power in our own lives to improve health.
Thank you, Laura. Angela.
A lot of lessons, of course, but again, sort of focusing on my work in emerging markets, the most important currency to do business there is relationships. And for me, this survey really just underscores that this has to come with trust, and this has to be earned and maintained over a period of time. I think healthcare professionals, and that's broadly defined, and it includes folks like us, have to be very intentional about the desire to develop this sort of trust with patients and the community if they're to have any meaningful impact. I mean, I think the piece that is going to stay with me from this survey is just the desire, and I think we've all talked about this, for patients to be spoken to as equals. And it's very powerful, especially in markets like mine, where doctors and healthcare professionals, are considered sort of, all-knowing, and this can lead to very paternalistic relationships. My father was a doctor in Kenya for many years, and he'd always say to us, 60% of his conversation with patients was not related to their illness or medical condition at all. He would chat to them about their kids, their families, the current events, whatever they wanted to discuss. And I think, he understood that, to engage with patients in a wholesome way, listening to them as peers in the human experience really went a long way. And I think there are lessons there for all of us, not just those who are providing healthcare directly, but really seeing patients as folks who really need to hear from us in a way that makes sense to them.
An incredibly real example of the data that we just showed, why that's so important. Mark, concluding thought from you.
What Angela said, I think it's the warning is in the data, but so is the way forward, in that treating people as partners in an exchange of information and as equals, as people who are respectable, who we respect, is the way to get through the trustworthy, the trusted information, to be trustworthy. It's interesting because actually that's what all the people who we're trying to work against here do sometimes incredibly well. One of the reasons why conspiracy theories and misinformation is successful is it meets people where they are, and it doesn't threaten them, and it tries to work off the back of a connection with things that people feel. And I think if we can do that, we'll be successful in the end.
Very, very wise words, Mark. Sreejit, last comment from you.
I'd say the most encouraging has been the data around the empowered patient, that more people are now seeking out health information, verifying the quality of that health information. Because what that tells us is that you have an engaged audience, you have an engaged society and an engaged patient community that you can work with to design high quality health information, high quality programs. And the other thing is, I would say that it will then create fertile soil for advocacy around topics that are really important that we can collectively work on. So I feel empowered and educated and aware society on health topics is a very encouraging sign.
So I am going to hand it back to Richard. I am not going to make concluding remarks because I think you covered so much ground, and I think each of those snippets from the four of you was so profound. Can I thank you on behalf of Edelman for the time you've given us today and for your really remarkable insights. Thank you. And I'm handing back to you, Richard.
Thank you.
Thanks, Kirsty. And thanks to Tony and Dave for such a superb survey. The quote from Marie Curie is very apropos. Nothing in life is to be feared. It's only to be understood. Now is the time to understand more so we may fear less. I want to draw on that because science is ahead of society. And we need a new compact between science and society that is premised on transparency, benefits to all, and two-way conversations. And I think the panel did a superb job of explaining how we get through a world of dispersion of authority, diminution of expertise, and ideology equaling identity. But this new compact between science and society is urgent. A second thought. You know, at the worst part of sort of December and everybody fearing inflation, it was a question of heat or eat, I heard when I went to the UK. I think it's heat, eat, or be well now. It's all three, because, in fact, the fifth force in polarization is health. And whether it's inflation, access to doctor, access to quality information, fear of job loss, education, or racism, all of these are playing into this problem. I think one of you, Angela, was the role of the employer is most believed by those who are skeptical. We have a privileged responsibility, not role, but responsibility, because we are the credible source. We're also close to people, and we should give them quality facts and give them access. I also want to put one idea forward. We need a health goal equivalent to the net zero goal established in Paris. We should have a big idea that reframes the health conversation. We should really bring a summit together equivalent to the Abu Dhabi COP28, and the health institutions need to come together and say, we are committed to health for all. With that, thank you all.